Asbestos is a known carcinogen, and there's no safe level of exposure.
Mesothelioma is a miserable disease.
They must fight a truly global battle.
We want to demonstrate our enormous respect.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Keep me in your heart for a while.
Everybody else here has been talking about disease in the past, present, and in the moment. And a little history, I guess I should start with, is how I met Linda. My husband had just passed away. I'm a widow of 8 years now. He had passed away a couple of months, and I got a phone call from a woman I didn't know. Her name was Linda Reinstein. And she said, I just had to get a hold of you. I've heard about your husband, and my husband, Alan, is sick today. And so she's always been in my mind and in my heart, as many of you here are today. So that was my first connection. And then this past year, Leah and Stacy decided they wanted to do a walk to remember their father. And so they called me and said, sure, we can do this. And so we had this wonderful walk that we pulled off in Sarnia, and they invited Linda to come and be part of this walk as well. So, well, we had Linda's attention for a while because, you know, we're a little farther away, so we could hang on to her for a bit. My daughter, Sherry, in the back here, we decided that we would give Linda a little better snapshot of our community. And so we hurry her off. So we commandeered a friend of ours, Ada Lockridge, from one of our First Nations reserves, and we took her on what's called the Toxic Tour. We live in a beautiful community. We're right on the water of Lake Huron, but we also live in the corridor from Port Huron, Michigan to Detroit, Michigan, where we have over 60 industrial communities there. And so we have a lot of other issues as well, which create the issue of what we're here today, of occupational disease and mesothelioma. So when we were also had Linda's attention, we took her to our new hospice that we've had built, and we're quite proud of that, and we're pleased to have that. We didn't have such services in our community years ago when my husband was sick, and when others were sick as well. And I worked in community health care at the time, and so I've seen a lot of this. I've become a community advocate, and I'm the chair of the Victims of Chemical Valley. So I've been touched in a lot of ways, and I see a lot of people. So today, Linda has asked me to talk to you about the hospice, which doesn't sound like the most pleasant thing, but you know, we're so pleased to have what we have, and so I'll share a bit of that today. So I live in a community called Sarnia, and it's the county of Lambton. And I'm going to talk to you about the mesothelioma and the hospice. I sort of had to try to give you a full picture of what's going on, because just to say, oh, here's a hospice, what does that mean to you? First time doing this too, by the way. So how mesothelioma and the movement began in Sarnia. And as our two previous presenters, they talked about Holmes Foundry. And in 1994, Holmes Foundry insulation was cited as being the largest catchment of asbestos-related disease in this community. This plant has since closed in 1988. It was closed in 1988, so these people were dealing with a plant that had already closed its door, and trying to lobby the government and go back to the plant on restitution for these workers was not an easy task for these people. This plant, as Alec had said, there were a lot of migrant workers there, but it was their brave women and the men that were left that really stood to the task. And I'll tell you today that there's not many of those men left working. They're not working at all, but they're not alive today. The biggest industrial industry in Sarnia contributing to the cause of mesothelioma and asbestosis was Holmes Foundry. Other plants have since shown an increase in numbers, such as Dow, Imperial Oil, Polysarnova, Shell, and Suncor. And it was at that time that one of our community members, Bud Simpson, and his wife, and he was a fiberglass worker, began to notice that we had numerous friends in the obituaries. And you know, not everybody reads the obituaries, but once something catches your attention, and for me, that was part of my job, was to read the obituaries. And I always just say to my husband, like, they're so young, why are they dying? I don't understand this, you know. We're so young. They retire at 64 or 65 and they die tomorrow. Like, what is that all about? So Bud couldn't get the attention of anyone in the community, so he went to Windsor, where he got the attention of Jim Brophy, and asked Jim, could he come to Sarnia? Could he come and look at what's going on there? And so I'm just kind of going over this briefly because it's a whole big story, but here's the short version, okay? So Jim came to Sarnia, and with his coming to Sarnia and looking and body mapping, as you were shown here, we were given a clinic, but it never had permanent funding. And through all of this, a grassroots organization began, and it was called the Victims of Chemical Valley, and it was consisted of the workers and their widows, mostly the widows, and these women are so brave. I can't even begin to tell you how brave these women are. And, you know, today we don't have the membership that we used to, because in my community, people have become complacent. They just know they're going to die. They accept that, and they should never accept that. So the Victims of Chemical Valley were formed at that time, and again comprised of the workers and the victims. So how has the Victims of Chemical Valley, and we use the short term VOCV, impacted the community? Well, first off, these brave women and a number of our labor men from the community, they went to Queen's Park to try to talk to the Labour Minister, Mr. Flaherty. They wanted to get his attention to let him know what's going on in this community. Well, these brave women and these men decide they do a sit-in. Now, can you imagine a bunch of elderly women, grab it, a bunch of elderly women who said, we're not leaving. Close the door, we're not leaving till we see this man. So I don't know how many hours had passed. I wasn't part of all that at this time, but maybe Alec can, if you're interested, he can share this a little bit better with you. But they did this sit-in, and it was in 1999. And so we did get an occupational health clinic in our community. It was never given permanent funding because it was just going to go away. This would all blow away in a couple of weeks and everything would be just fine again. Well, it didn't. And in 2004, we invited Chris Bentley. He was the new labor minister at the time, to come and see our clinic, see what was going on, show him the body mapping, and discuss with labor and with people who had lost their spouses or people who are currently ill what's going on here. And it was at that time the Occupational Health Clinic for Interior Workers was given a permanent clinic in the community, and it was administered and funded through WSIB, which is the Workers' Safety and Insurance Board. Gotta love the insurance board. So this group also, through their work together, decided that they wanted to build a memorial, and it's a memorial for the missing worker. And it was erected in 2002 through fundraising and donations by these brave men and women in the community, using the work of the labor to erect this. And we've erected it down at the bay, right on the water. And this memorial, you'll see the shadow of a man, and through that shadow you can see the wife and the children. And in front of this, you can't see it in the picture, but there's a fountain. So if you stop, or anyone stopping by to take a drink of water, and if they look up, what they can see is the stacks of the plants in the back. And this was the first memorial that we're aware of that was ever erected by the people of a community, for the community. So at this memorial, every April 28th, which is International Day of Mourning, we use this as an opportunity to gather down at the bay and use the memorial to honor those who have been injured in their workplace or have died because of their occupational disease there. It's quite a moving ceremony. It's always really cold because the water's there, and we live in Canada. Oh, I'm Canadian, by the way, sorry. And so we down there, and we every part of our ceremony we do a dove release, which is quite moving, as these doves, and it's usually around 6 o'clock at night. We release these doves to some music. We play Josh Groban, and it's very, very deep, let me tell you. It's can't even talk about it. So the doves are released, and what they do is they'll fly around, they'll circle around until the last dove is released, and that last dove is the dove that will take them home, as it will take our members home, our husbands home, our wives home, and our children, because we lose not only the workers, we lose their spouses, and we lose their children. Community health care, that's where I worked for over 23 years. And it was in the late 1990s and the early 2000s, community health care was not recognizing occupational disease and asbestos-related illnesses. This is where I had my first glimpse, because my job was to take care of all the medical supplies for our community nurses and to authorize equipment. And so I kept seeing this little product come across, was CAD pump. CAD pump. Oh, what's a CAD pump? I like to know my products, so I was asking, I don't know what that is. I don't know it. Well, you people authorized it. I got to do it again. Tell me what it is. It was a pain pump. And we used cassettes infusers, which had the drug in it. So it was a continued infusion of the pain medication so that the person using it never had to be in pain again. Wonderful product. But as I'm posting into this program that I designed, I said, oh, good, he's not using it anymore. Oh, Bob's not using it. Oh, he must have got better. Oh, Steve's not using it. He must have got better. No, they died. And I looked at that and I thought, oh my God, who's tracking this? Something's going on in this community. We've got to figure this out. So I booted in the boss's office and said, we got a problem here. We got to fix this. Something's going wrong here. He said, don't worry about it. I said, excuse me? No, there's a problem here. Can't you see this? I'll show you this. I've got it in black and white. There's a problem here. So we don't worry about it. I said, well, who's worrying about it? The Ministry of Health, the hospital, who's worrying about it? Oh, that's not our job. Well, whose job is it? Whose job is it to worry about all these people dying? There is a problem in this community. So that was my introduction. My second introduction was my husband became ill and trying to maneuver the system. Once I thought I knew the system because I worked in it. That is the hardest system to maneuver you can ever imagine. If you're sick, you can't imagine. So my husband was ill, and we had to deal with that. But also at that time, we had a small palliative program in our hospital. And in that there was I think it was a 10-bed unit. And our community is so generous with their funds, and we're a very small community, and we don't have a lot of money, but our community always cares and always donates. So after death, they were always giving money to the palliative care unit. Well, the CEO of the hospital wasn't putting it towards the palliative care unit. He was using it for somewhere else in the hospital, like redoing his room, new desk. I think his desk was 10,000. So he was looking pretty fine as our people were sitting in beds that weren't working very well, chairs that weren't the best. And that's what the family had to sit in while they stayed with their family members who were dying. And so he decided that it was too expensive to run this, so we're going to close our palliative care unit. Well, that ticked us off. And we're Canadians, we're a little complacent on a few things. Don't mess with the palliative care unit. I tell you, we took to the streets like nobody's business. We made signs. We were standing on the corner honking and everything we could do to make noise. And at the end of the day, we went to City Hall. I've never seen my community do this ever. And I still, to this day, I haven't seen it do it ever. And I wish all those people that stood out on the street and said, yes, we need our palliative care, would show up at our International Day of Mourning, because that's where you can be seen and that's where you can be heard. Again, we're a little complacent on that. So we caused a large uproar, and because of that, we got a stay for our palliative care unit for 4 years. This is a picture of my husband, Blaine, in palliative care unit at the time, and 3 of his nurses. And it was a picture taken by Louis Palou, who was a reporter for the Globe and Mail, who came to our home and did a large spread on my husband and the issue of mesothelioma in the community. And so he graciously allowed us to use this picture. And it was like that in his room all the time, by the way. And so this is a picture of our St. Joseph's Hospice, of the, it's not the residence, it's the house. It's the resource center. And it was a generous donation by Ron Gordon, the Gordon family, because we didn't have a place to build our hospice. And so Mr. Gordon said, here, you take this house. He gave us this beautiful old Victorian home, and it today is our resource center for our hospice. And with a donation by a group of family members whose father had died from occupational disease, they donated $1 million to get this campaign off the ground and build a resource center and get a 10-bed residence built. The center opened in 2005, and our residence opened in 2009. And here are some of the features of our residence and our resource center. The St. Joseph's Hospice supports not only the individual who is dying, but cares for the whole family. That includes the patients, caregivers, and bereaved. We offer bereavement groups, and what we try to do is critique these to the individual needs, such as, for myself, spousal. So instead of being in a room where somebody's lost a mother, a father, a brother, a sister, we try to have, so it's all someone who's lost a spouse, male or female. We have had a lot of suicide in our community of late, and for young teens, and so we try to get things going for them. And so we have the Caring Hearts program, which will, Connie takes care of the children from age 3 to 17, and she is amazing with these children, the young children and the older children. She goes into the high school, because can you imagine being a teenager and your father's died? And you think, I'm the only one, why me, why me? But then they realize there's 5 or 6 other children who have been in a similar situation. So there's a bonding that goes on and a sharing that goes on, that they're able to put that out a little easier and not internalize so much. Can I? Okay, sorry, talking to you. And so we also have complementary therapy. And that every Wednesday we have Reiki, therapeutic touch, massage therapy, and either a patient, caregiver, or bereaved person can come in and we take care of them. We try to take care of the whole person there. So I'll just slip past my pictures here. Caring Hearts program. Our hospice is open 24 hours a day, staffed by, we have over 400 volunteers there. And I did want to tell you about we have a doctor on staff, Dr. Madison. He's pain and symptom management, so that people do not have to go into hospital, depending on what stage they're at. They can go right into palliative care. They can bypass, emerge, all those things. This is funded through the government by the Ministry of Health and Long-Term Care, and it costs no one to stay here. Sorry, Linda. I just had a lot of pictures here. The fabric of Sarnia Lambton, the fabric of Sarnia Lambton is intricately woven with the issue of occupational disease and mesothelioma, the chemical valley, and the release of toxins. By standing together, we can have and will continue to make a change for the future. And this is why I am so passionate about occupational disease and mesothelioma. These are 6 members of my family that have been lost to the disease. Thank you.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Your heart